Thanks so much for joining me today. I'm Dr. Catherine, a GP, and today is one of my Ask the Expert sessions with consultant gastroenterologist Dr. Gareth Parkes. We'll be talking about your gut and, importantly, how to get to know your bowel symptoms. Don't forget to hit the subscribe button and ring that bell, like and share and comment. Make sure you watch through to the end to hear his top tips. Gareth, how do we know when you need to talk about symptoms with a healthcare professional? And also, tell us about screening for bowel cancer.
Well, obviously, symptoms are the things that most patients are concerned about, and lots of consultations will be around that. If you have a strong family history of bowel cancer in your family, then that's something to definitely remember. And if it's happened quite young in your family, it may be that you should have colonoscopy earlier on. But again, that's something your GP should be able to help you with. You might need a referral up to come and see someone like us. But for a chunk of you, you will be offered screening. And we do this because bowel cancer, sadly, is quite common, one of the biggest causes of cancer death in the UK. And 1 in 20 of us in our lifetime will develop bowel cancer. Now, it's important to point out that bowel cancer doesn't start off immediately as cancerous cells. It doesn't go from being normal to cancerous immediately. And there is a stage that we commonly call a polyp that can occur first. And if we find polyps rather than cancer, we can remove them completely, nearly always with the endoscope. So without the need for major surgery, no need to resect a bit of bowel. And we now recognize that you're somebody who's more at risk of developing further polyps, and more importantly, somebody who's at risk of developing cancer. So you'd then be offered colonoscopies on a regular basis. So if you do see symptoms, then for goodness sakes, go and see your GP, because this is definitely something that's treatable. Even if you've got cancer, stage 1 bowel cancer's got a 95% 5-year survival rate. Stage 2 is around 85%. So we've got really good treatments for this as long as you present to your GP. It's the people who stay at home that make us most concerned. Screening is a bit different. And at the age of 55 in certain areas in the UK, you'll be offered the opportunity to come up and have just a limited look up the left-hand side of your colon. And then from 60, the whole of the UK, through until you're 74, every 2 years, you'll be sent out a small package through the post. And in that is a bit of kit, which allows you to take a sample of your stool. We now have a really sophisticated test which uses some clever immunology to detect whether there's any blood in that stool sample. And if there's microscopic levels of blood, so not detectable with the naked eye, then you'll be offered to come up and have a full colonoscopy. Because what we're hoping is that the reason for that blood is not that you've got a cancer, but that you've got a polyp. Or if you have got a cancer, it's in such early stages that you haven't got any symptoms. So the idea is then you'd have a colonoscopy, we'd understand what's going on, and then offer either removal of those polyps then and there, or surgery, or whatever. And for lots of patients, of course, there is nothing. We don't find anything. That blood might have been from something like a hemorrhoid, but it's really important. So if it's either you or a loved one, please, I know it's stool and I know you've got to take a sample of that. And for some people, that really puts them off. But a colonoscopy is a really straightforward test.
As a specialist in gastroenterology, you see lots of different gut issues. You also have a special interest in inflammation of the bowel, and I've seen that you've co-developed a great app for people with colitis called My IBD Care. Can you tell us a bit more about that, please?
So yeah, about 50% of my job is looking after patients with 2 conditions called Crohn's and ulcerative colitis. And these are inflammatory conditions, just as you said. So that's where the body's immune system attacks the delicate lining of the gut, leading to ulceration, bleeding, which can often manifest itself as things like diarrhea, tummy pain, bloating, weight loss. Patients can become fatigued, anemic. So it's a myriad of symptoms, and it's something that disproportionately affects younger patients. So most patients will present in their teens, 20s or 30s, although it can happen anytime through life. It's a hugely satisfying condition to treat, because if we can get on top of it and treat it with medication, we can actually turn these young lives around and they go on to have completely normal, healthy lives. And all the immunology is really interesting as well. With the My IBD Care App, we've been looking at novel ways of trying to look after patients. And I think the pandemic has really highlighted the need for these across all of medicine, and we're taking part in that. Essentially, our old way of looking after patients was to see you in outpatients, and then we'd see you again in maybe 3 months, 6 months, or 12 months. But in the rest of that time, you didn't really have a huge amount of support. So in the first instance, the app is a kind of companion to help you with your disease. It's got things to remind you to take medications, help with appointments, and it's got lots of information and education for patients in there as well. And then we've developed a clinician portal, which allows us actually to even interact with your clinical team so that you've got a kind of two-way conversation that can be ongoing when you're unwell. And we can then take that even further and say, look, if you're completely well and you can enter in your symptom scores on the app, then we don't need to see you and bring you up to come up to hospital. And that's a super useful thing. And we've finally developed some modules with some behavioural scientists to try and overcome some of the things that we know can contribute to inflammatory diseases. And this is true for all sorts of inflammatory diseases. So things like a poor night's sleep or feeling really stressed and anxious, we know can make your gut symptoms worse. A lack of exercise, poor diet. So we've created modules which can help you try and improve some of those things with a goal to try and help you keep your disease under control as much as possible.
Thanks, Gareth. That's really helpful to understand what's normal and which gut symptoms to look out for, and also to hear about your IBD Care app. If you want to find out more, take a look at another session with Gareth and I talking about what you can do to help yourself get more good bacteria or COVID-19 gut symptoms. In the meantime, don't forget to hit the subscribe button, ring the bell, like and share and comment. I'm Dr. Catherine saying goodbye and keep healthy.